A girl has made a promise, and today a girl must keep that promise. In our last video where we talked about the labia, and also in the previous videos that we've been talking about the vulva in general, I told you that every single thing I teach on this channel is not just my opinion or something I read on the internet. And I said I was going to come back with the actual evidence, the medical research, official statement, everything that proves that all I have been telling you about your body is not made up. It is experimented, it is documented, and it is published, and it's sitting in the same libraries that doctors read from. Well, let's not talk too much. I brought it, so let me show them to you. And if this is your first time here and you're probably wondering, what evidence? What are they trying to prove? What is she talking about? Calm down. Let me catch you up real quick. Hi, I am Excel Chris, and this is Woman Know Thyself. And on this channel, we are going through the female body part by part, structure by structure, and bit by bit. And one of the things that we've been covering in our anatomy series is the vulva, which is what every woman has in between her legs, which is what this diagram is. We're talking about what it is and what it is made of. And during those videos, I made a very specific claim. I said that vulvas are not all the same. They come in different shapes, sizes, color, symmetry, you name it. I also said that what you've been seeing in magazines, internet, movies, even some medical textbooks is not the full picture of what a normal vulva should look like. And the shame that so many women carry about the appearance of their vulva is based on a lie. There is nothing wrong with how your vulva looks. I made that claim and I promised I would not just say it and move on. I was going to come back with the actual proof. So here we go. So if you want to watch the full anatomy series from the beginning, which I highly recommend you do, the playlist will be linked below. But if you're starting right now and right here, then you're still in the right place. So let's get started. Now let's start with the actual science. This study was published in BJOG, which stands for the British Journal of Obstetrics and Gynecology, which is one of the most respected medical journals in the world. And the title of this research is Female Genital Appearance, Normality Unfolds. Oh, how I love this title. And it was written by Julian and her colleagues. Now, here's what they did. They took 50 women, 50 regular women, not models or actresses, just 50 women that agreed to be part of this study. And they physically measured their genital areas, the length, the width, every part of their vulva. Now they took this real number and data, published it, peer reviewed it, which means other scientists actually checked their work before it was allowed to be published to BJOG, which is the same process like every other medical research. And then what they found out changed how doctors themselves understood what counts as normal. And now I'm going to be reading some of that to you. And I want you to really listen to these numbers, because by the time we are done, you will now understand that some of the things that you were worried about, you were probably worried for nothing. Let's get started. Now understand that I'm going to be reading highlighted points in this research. It's not like we are reading all 3 pages of all of the evidence that I brought. Just the highlighted points, enough to give you the accurate, detailed information I want you to get from this study. Introduction. Although representations of female nudity are common, but detailed, accurate representations of female genitals are rare. And it is notable that even some textbooks of anatomy do not include the clitoris on diagrams of the female pelvis. The first statement says, although representations of our genitalia are everywhere and we think we see these things everywhere, but accurate, detailed representations of what an actual vulva should look like is actually rare. So what do you now call all of that we've been seeing? Women who seek cosmetic genital surgery fall into two main categories. Firstly, women with congenital conditions such as intersex, for which current standard practice advises feminizing genitoplasty procedures with the objective of reducing clitoral size and opening the vagina introitus. This is women that actually have a condition that needs this cosmetic surgery. That's the first category of women. Now, secondly, some women with no underlying condition affecting their genital development also seek surgery to alter the appearance of their genitals. For example, labia or clitoral reduction. Reasons for such requests are far from understood, but implicit in a woman's desire to alter genital appearance may be the belief that her genitals are not normal, that there is such a thing as normal female genital appearance, that the operating surgeon will know what this thing is, and that he or she will be able to achieve this for her, and that this would somehow improve her well-being or relationship with others. So this is saying there are two categories of women that undergo cosmetic surgery. The first category are those that should medically undergo this surgery, and the second category, they don't understand why. Now they are assuming that many a times this might be because these women think there is something wrong with their genital area. They think there is such a thing as normal, and for some reason they don't think theirs falls into this category of normal, but they assume that the surgeon does, and he or she would be able to help them achieve what this normal is in their own body, and then that will help their relationship with themselves or with their spouse or with every other person. This is what BJOG said. There are few reports in the literature regarding overall normal female genital appearance or normal dimensions and exact positioning of the vagina, clitoris, labia, and urethra. Yet, this information is actually crucial for surgeons and patients in planning for and assessing the cosmetic outcome of genital surgery. The current study aims to address this gap. This study aims to address this gap in our knowledge by providing data on how the anatomical dimensions and configuration of adult female genitalia. So what this is saying is that there are little evidence, there are little studies or reports in literature regarding what the standard range of normal should look like. The doctors and patients themselves don't even know much of this. So this study was carried out to address that gap in knowledge so that we would now know what are the variations. Yes, there is a range. The range falls from where to where, the range of normal. That is what this study is aiming to address. Now, the method that was used in carrying out the study. Participants were excluded if there were, now these are the category of people that were not allowed to participate in this study. First of all, if there were non-English speakers without an interpreter present, people that were under the age of 18, was post-menopausal, which means if you're already in menopause, you were not allowed to participate in, and if they had previously undergone any surgery to the external genitalia, any form of surgery whatsoever that alters your external genitalia, and also women that have undergone female genital mutilation were also excluded. Now, all women were premenopausal and aged 18 and 50 with a mean of 35. So the average woman that participated in this study was 35. 3 women had never been sexually active. 29 women were nulliparous, which means they had not given birth, and 18 were parous, which means 18 had given birth. The majority of women were white, with 5 Asian women, 6 black women, 1 Latin American woman, and let's go to the results. Now, there's a chart here. I'll display it on the screen. The clitoral length for these 50 women. Now, the range that they found, the range that they measured for the clitoral length in millimeters was from 5 to 35. The average, which is the mean, being 19.1. So they measured for each woman it was from 5 to 35 for all 50 women rather. The clitoral gland width was measured 3 to 10, the clitoris to urethra 16 to 45. Are you seeing the range? The labia majora, the labia minora width, perineum, every other thing. Now let's go to the color of the genital area compared with surrounding skin. For women that had the same color with their surrounding skin and their genital area, it was 9. And then women that had it darker, 41. Out of 50 women, 41 women had their genital area darker. I made a video which was specifically actually talking to black women, telling black women that it is okay for your vulva, which is your genital area, to be darker. And while that video was addressing black women, but this study that was primarily white women that were involved in this study, yet 41 of these women the study found that their genital area was darker than their surrounding skin. Just wow. Let us proceed. The discussion, this is the whole discussion that they had about the study. We're going to have to skip that. Now let's go to the conclusion. We have examined the normal ranges of genital measurements in women and demonstrated that there is far greater diversity than previously documented relating to labia and clitoral size, color, rugosity, vaginal length, urethral position. So future studies would be useful to clarify if such wide variation is displayed in more homogeneous ethnic groups. This information should be considered in the decision and planning of any reconstructive genital surgery. Many options exist in the health services and the community at large for resolving personal or relationship dissatisfaction and distress other than surgery. So they are saying this or this should be considered before you decide to alter your genitalia, before you think there is something wrong with your genitals that needs fixing. You need to consider the level of diversity that was studied in these 50 women. And it is saying that there are other options that exist in health services aside from surgery to fill in the gap for your dissatisfaction or distress about your genital area. So that is all for this medical research that was conducted. Let's move on to the next one. Now, this next one, I need you to pay very close attention because this is not me talking. Neither is this one doctor's opinion. This is FIGO, the International Federation of Gynecology and Obstetrics, which is the global body that represents obstetricians and gynecologists from over 130 countries from across the world. So when FIGO releases an official statement, it is not one person's view, but a position that is formed by an entire international medical community that is built on years of observed patterns and accumulated evidence of doctors that have been treating women everywhere across the world. So when an organization of this size and credibility puts out a statement like this, that statement carries weight that a single doctor's opinion never could. And this right here is the closest thing you will get to the entire medical world standing up at once and saying, we need to talk about this. So you can see that this statement is not just mere paper. It carries weight. Let's proceed. So the title is FIGO Statement, Cosmetic Genital Surgery. The link is going to be on your screen. Introduction. Female cosmetic genital surgery encompasses various procedures including labioplasty, clitoral hood reduction, hymenoplasty, labia majora augmentation, all of that anyways, G-spot amplification, as well as laser-based techniques. The American College of Obstetricians and Gynecologists describe these as the surgical alteration of the vulvo-vagina anatomy for aesthetic reasons in women without structural or functional abnormalities. In recent years, there has been a growing awareness of and demand for these procedures. According to the Aesthetic Society, labioplasty procedures saw an increase of 29.7% between 2015 to 2019, with nearly 47.9% performed on women aged 18 to 34 years. So you can see that these are young women. Likewise, the International Society of Aesthetic Surgery reported a rise of 33.4% in cosmetic genital surgery between 2014 and 2018. I'm just trying to give you a backstory of the level of increments that these surgeries have had over the last couple of years, right? Now let's go. Several factors have been identified as driving the increasing interest in cosmetic genital surgery. The widespread removal by shaving, waxing, electrolysis, or laser treatment of pubic hair has drawn more attention to natural variations in external genitalia. And what this last line is saying is that because of the recent culture of pubic hair removal, if you've watched my video on mons pubis and pubic hair, remember I mentioned, if you've not watched that video, I'd advise you go and watch it. When you look in between your legs as a woman, this diagram is showing a vulva that has been spread open, so you're seeing the features properly. But most of the time, you have to spread in between to be able to see it properly. So aside that, this is closed and you're standing. These are the two major parts of your vulva that you would see while standing. And majority of the time, like I said, for most women, they never go down there to see what they have in between. And I really don't know why. I'm going to have to address this some other time. So before now, these are the major things you see in between your legs. Your pubic hair covering your mons pubis and even the labia majora. And you don't really get to see too much until you go searching, right? Now, this is saying that because of this recent culture of pubic hair removal, the natural variations, natural is what it used, natural variations that you would normally have in your vulva became more noticeable. Attention was now drawn to it. So when you shave off your pubic hair, you start to see these things. Oh, my clitoris is longer. This is this. Why is it like this? Why is this? You would never have known if you didn't shave off your pubic hair. So this study is saying, FIGO is saying rather, that this is one of the things that made women's attention to be drawn to this place. Let's proceed. I think I'll just take that line again for better understanding. Several factors have been identified as driving the increasing interest in cosmetic genital surgery. The widespread removal by shaving, waxing, electrolysis, or laser treatment of pubic hair has drawn more attention to natural variations in external genitalia, making asymmetry more apparent. In addition, greater exposure to media and online content has reinforced the notion that certain genital appearance do not conform to an idealized aesthetic standard, prompting more women to consider surgical alterations. A comprehensive review of materials searched online promoting cosmetic genital surgery in women revealed that normal anatomical differences are often misrepresented as abnormalities, leading to distress and, in some cases, sexual dysfunction. Furthermore, marketing strategies frequently make misleading claims, suggesting that these procedures can address functional concerns and improve sexual satisfaction. You now see where the problem is coming from. Let's just proceed. I guess this is self-explanatory. In 2013, the Royal College of Obstetricians and Gynecologists, in alignment with ACOG, which is the American College of Obstetricians and Gynecologists, stressed the importance of providing women with accurate information about the natural variations in female genital anatomy. They also cautioned against advertising that may mislead women into thinking surgery is required to attain a normal appearance. Are you getting what we are reading? I hope so. I just hope so. Let's proceed. A significant concern in this field is the emergence of industry-driven diagnosis where, let's just skip all of that. I'm going to advise you to take your time to read through this whenever you feel like. Now, I want us to just skip some of these. This is already giving us clarity. This is already opening our eyes, right? Let's move. In the guideline number 423, the Society of Obstetrics and Gynecology of Canada highlighted several key points. Number one, there is scarce scientific evidence supporting the claim that cosmetic genital surgery in women is safe and effective. as far as improving body image or sexual reproductive health is concerned. Now imagine going through all of that trouble and it is said that it is not even necessary because what you think is abnormal based on the information that you've been fed and how you've been conditioned to see your vulva is actually normal, but then you refuse and you decide to go through all of this trouble either ways. And now they are saying that there is little to no evidence to prove that this procedure is even safe and effective. Let us proceed. Number 2, major professional organizations agree that these procedures lack strong evidence of both safety and efficacy. That's basically the same thing with number 1. So imagine them having to repeat it twice. There is no strong evidence to prove that these procedures are safe, efficient. So why go through the trouble? Number 3, advertising and discussions about these surgeries should be factual, evidence-based, and impartial. What this is saying is that cosmetic surgeons that are doing this advertisement for these procedures should give factual, impartial, and evidence-based claims while they are doing this advertising. That shows that that has not been ongoing in the past, and this can be misleading to the recipient of these advertisements. Let's proceed. Women considering this procedure should receive comprehensive information about the normal anatomy of the genitalia and normal physiological function, as many women may ultimately decide against surgery once they are fully informed. This is saying that majority of women that actually undergo this surgery are not given proper information about what normal should actually look like. Else, majority of them would not even consider the surgery in the first place. And before surgery is carried out, they should ensure to give the proper, accurate information about what the actual anatomy should look like before allowing these women to proceed with these surgeries. Now, that is for the Society of Obstetricians and Gynecology of Canada. There's another one, the International Federation of Gynecology and Obstetrics, which is FIGO, whose statement we are reading. Their guideline 0.055 outlines 4 ethical criteria that must be met for cosmetic surgery procedures to be considered permissible. Let's look at it. Number 1, the procedure should not address an underlying pathology, meaning it is not medically necessary, right? So the procedure, you should make sure that the procedure is not underlying any medical condition whatsoever. It's not a necessity. 2, there must be evidence-based clinical validation proving the procedure's safety and effectiveness, which we already read from the Society of Gynecology of Canada that there is limited research or resources around that. So the second criteria is that there must be evidence-based clinical validation proving the procedure's safety and effectiveness. Number 3 says risk and complications should be minimized, adhering to beneficence, based clinical judgment. Let's leave that. Then number 4, the patient must provide informed and voluntary consent, which includes awareness of both biomedical and psychological risks, such as potential dissatisfaction with the outcome. Due to the lack of strong evidence supporting the claim that cosmetic genital surgery is safe and effective, the second criterion, which is the one that said there must be evidence-based, is not fulfilled. Consequently, FIGO asserts that this is ethically inappropriate for obstetrician gynecologists to recommend, perform, or refer patients for these procedures. Pens up. Unless there is strong evidence that shows that the safety and effectiveness of this surgery is guaranteed, then FIGO has said it that it is ethically inappropriate to perform, to recommend, or refer a patient to it, especially when it is not a medical necessity. That's not all. Now let's move to recommendations. This is now FIGO's recommendations. It's just stated here, recommendations. Women should receive counseling and be informed that cosmetic genital procedures are not medically indicated and come with potential risk. Currently, there is a lack of high-quality research confirming their safety and effectiveness. Do you know the number of times that this has been repeated? I guess that goes to prove something, right? All right. 2, obstetrician gynecologists should educate women about the natural diversity in genital anatomy. Tell them, let them know. This FIGO is mandating obstetrician gynecologists to educate women. When a patient comes to you and say, doctor, I think I need to undergo cosmetic surgery. I think I need to fix something that I think is broken. It is your job to educate them and let them know that there is diversity. There is a wide range of what is normal, and you have to reconsider this. Highlighting that variations in different characteristics such as color, size, and shapes are normal. Oh, let us proceed. 3, obstetrician gynecologists performing these procedures must have proper training in cosmetic genital surgery. Patients should be informed about their surgeon's level of expertise. How I wish this is practical in my country. Imagine if you're in my country, you should know where I'm coming from. Imagine your surgeon walking in and you are asking them while an operation is about to be carried out, and you are asking the surgeon, please, can I know your level of expertise? I want to be sure that you're qualified enough to carry out this operation. You see, they will just leave. Oh, you won't even try it. But this is what FIGO is saying. Whew. Am I getting dramatic? Am I overreacting? No, I am not. I'm not overreacting, okay? I'm not. Let's proceed. Patients should be informed about their surgeon's level of expertise and experience, including the outcomes of previous surgeries they have performed. Oh my God, I wish the word can be like this. Obstetrician gynecology should be able to identify patients with sexual dysfunction or mental health conditions such as depression, anxiety, or body dysmorphic disorder. In such cases, referral to a psychiatrist is the more appropriate course of action. If you notice that this person, the reason for this person wanting to carry out the surgery is because maybe they are depressed, maybe they are worried, maybe it's just a mental health condition. It's not really about their vulva or anything being wrong with them, then the appropriate course of action is to refer them to a psychiatrist and not to go ahead and carry out this surgery. This is what FIGO is saying to obstetrician gynecologists. Now, the last one, a thorough case-by-case evaluation is necessary before offering these procedures to adolescents. Factors such as, okay, we're going to have to leave that. Media marketing must be truthful and transparent. The practice of rebranding existing surgical techniques as new cosmetic procedures is deceptive, unethical, and should be actively discouraged. And the last one, caution is advised when using laser-based devices for all of this. I guess we've made our point. I guess FIGO has made their point, and I guess their point is well understood. And I guess you watching this video, you get it. You know what they are saying, and you know why they are saying this. We're going to have to proceed to the next evidence. Please don't get tired. We have 2 more from where these came from, and it's just about to get even more interesting. So far, we've covered 2 evidence, right? And I promised you 4, so we are not done. Meanwhile, don't get distracted by anything, okay? Anything, don't get distracted. Remember, the message is what matters. So avoid any distraction and listen, okay? Now, we've been able to establish something important, that natural variation in female genital anatomy is normal, right? And it is much wider than many of us women have been led to believe. Because it's one thing to say, oh yeah, I know we all have different bodies and there should be variation, but it's another thing to understand how wide this variation is. And I think that is what many women have not really been exposed to. And I think as humans, we've accepted variation quite well. I mean, look at us, from our faces, our bodies, our lives. We all vary in so many different ways, and we've accepted that quite well. But I think we've not fully embraced variation when it comes to our vulva. There is still the idea that there is one ideal standard, there is one normal, and if your vulva does not conform to this standard, then there is a problem. This thinking, this idea came from somewhere. How were we all conditioned? Okay, maybe not we all, but how were the majority of women convinced that there has to be one idea of normal and every woman's vulva has to fit that idea? How did we collectively believe this? What went wrong? That is number one, and that's the third evidence I'm going to bring before you. What happened to our minds? How did we look at our vulvas and think there was something wrong in the first place? Why? And this is very funny because, like I said, I have seen women that have never actually gone in between their legs to see what their vulvas look like. I've seen women that they don't really know what they have down there. They don't really know it as much as they know their faces, as much as they know their name or other body parts that they have. Yet they carry an idea of what is normal in their head. Where did that idea come from? If you don't fully understand yet what your vulva is, your own vulva, if you don't fully know it so well, you might not even be able to recognize it in a lineup. Where did you pick an idea of normal? That idea of a normal vulva came from where? Whose vulva did you see and assume it to be the normal? And how much has your exposure to such vulvas affected how you see your own vulva? That is what the third evidence is going to be covering. And the final evidence, which I think you should not miss, is where it gets even more interesting, because this time we are not reading any research papers, we are not seeing data or numbers, we are seeing real vulvas. Yes, I am showing you real vulvas from women like you and I, not models or actresses that are performing anything. I am showing you real, unedited, no filter vulvas from women like you and I that agreed to be part of a project where other women can see diverse vulvas, different skin tone, age, size, you name it. This is what seals it up for this series. So I've decided to make this a two-part evidence series, and in part 2, which is already up, the link is on your screen and in the description box, that is what we are going to be exploring. This two final evidence just seals everything up, and it is way more interesting. So I'll see you in part 2. Let's not talk too much, okay?